Here we have the anterior external surface of a sheep heart. First, let's orient ourselves to the anterior versus posterior. When you see a heart, you are not sure what you're looking at in terms of sides. So all the sides can be very confusing. You can see here the prominent features look like the main coronary artery going down, the left anterior descending. There's a number of coronaries that go around the posterior side as well as the lateral side. We can see a nice prominent fat band encircling this portion of the heart, which actually divides the section between where the ventricles are and the atria. The best way to determine anterior versus posterior is to look at the vessels at the top of the heart. The vessels here are often scrunched together when you get these preserved hearts. They've been packaged together. Where I'm sticking my finger here is a large opening in the back. This opening will go in, if you follow where your finger goes, into this brown feature right here. This is the left atrium. This large opening is the confluence of all of the pulmonary veins. So you don't see the 4 individual pulmonary veins as they enter here from the lungs. This over here on the right side is the right atrium. So we can see the 2 atria. This is the right atrium. This is the left atrium. This opening here is where the superior and inferior vena cava come together and enter. In humans, you will actually see 2 separate holes where the superior vena cava enters and the inferior vena cava enter the right atrium. In these sheep, we only see it as a single hole. So we have the right atrium and the left atrium. I can determine that easily because I already know that this is the front. But if you did not know it was the front, it is the vessels that will tell you. We have here, if we poke through, we have this is the aorta, and this also is a branch off of the aorta. What you should see is this little vessel here. It's not so little, but smaller in comparison in this view. This is the pulmonary trunk. This is the one that you will be looking for, because that is how you see the anterior side. You'll always see this pulmonary trunk coming off like a part of an X. If I stick my finger in this, you can see my finger is pointing into the right side of the heart. So this is the right side of the heart. The ventricle will eject blood out this way. So this is the pulmonary artery. It's always going to be the most anterior feature. So when you look at the top of the heart, it looks very confusing. Oftentimes you have this hole here, you have this hole here. You will always have the pulmonary artery in front of the aorta, and the pulmonary artery will always come off at an angle. So that is the best way to orient the heart, anterior to posterior. Some of the features that you will need to identify on the undissected superficial surface of the heart would be these vessels, the aorta. This little hole here is the first branch off of the aorta, known as the Brachiocephalic Artery or Brachiocephalic Trunk. So when the blood leaves the left ventricle, comes up, it will shoot out here on its way over to the right side of the body, as well as it continuing over. So this is a slice part way through the aortic arch. So this is your aorta. This is the pulmonary artery, left atrium, right atrium. We have posterior surface. In this posterior surface, the hole that you would see here that is posterior to our left atrium, this is the hole where the pulmonary veins enter. So this is where we would get the oxygenated blood from the lungs into the left atrium. Over here is the confluence of the superior and inferior vena cava, bringing blood, deoxygenated blood, to the right atrium. We can see a nice prominent base and apex. This is generally considered the left side, and this is the right side. This is the left lateral, posterior, and medial aspect. Well, this is a different heart. The front in this case is prominently wedged, so it doesn't look flat like one would expect the front to look. But what you can see is a very obvious pulmonary artery or pulmonary trunk that is the most anterior. We can see the aorta. We have the aorta, pulmonary artery. This is the first branch off of the aorta, the Brachiocephalic Artery. We have the left atrium and the right atrium. One thing I would like you to look at is this area where part of the epicardium has been removed. So if we bring the heart over here, let's zoom in. If you can see, it looks like a little piece of skin, so to speak, that I'm pulling up. This is, see how closely adhered to the surface of the heart it is. This is epicardium. If I pull it, you can see I'm really literally ripping some of the heart tissue off. That is epicardium. It is fused with and synonymous with visceral pericardium. It was the parietal pericardium that one would have to cut through in order to cut across, in order to open up, in order to get to the heart in the first place within the body. Let's cut this heart open so we can see what the inside looks like. I like to go about halfway to a little bit farther than halfway down with a scalpel. If we make a nice incision across the bottom, it makes it a lot cleaner. We can start to open this. What you should see is when you open up cut the apex off, we have the opening here. This is the bottom of the left ventricle. See how nice and round the muscle is around the left ventricle. Well, over here, the tiny sliver, it looks like a half moon. That is the right ventricle. See how thin the wall is of the right ventricle in comparison to how thick the wall is over here of the left ventricle. The heart is really built concentrically around the left ventricle, where the right ventricle is just placed on there like a side pocket. The right ventricle does not need to be as thick because it pumps blood into the low resistance area of the lungs. The left ventricle has to be very thick because it has to pump it throughout the body. One squeeze or one heartbeat ejects a volume of blood that must leave the heart, travel down to your toes, and come all the way back. So it has to impart a great deal of momentum. And the volumes between the left and the right ventricles are equal, even though the pressures are different. So the overall amount that they eject are exactly the same. They just have different strengths that they need to impart to the blood. If we look at it under here, we can see again the left ventricle, and then you can see the nice pocket view here of the right ventricle. And then this portion between the two chambers is the interventricular septum. Once you've identified that, it's much easier for us to look up into the right ventricle. Because of its thin free wall, it's easier to cut. So we'll cut up into the right ventricle. Just go up this way. And as we go, I'll open up the right free wall so we can see up. And what we're going to do is look at the inferior aspect of the right atrioventricular valve, more frequently known as the tricuspid valve. Actually, perhaps here. Once we have sliced up the free wall of the right ventricle, you can open it up, and what you see is the tricuspid valve. Within here we can see one flap. This is a tricuspid valve. There is another flap down here, and then a flap against the wall. There are actually 3 distinct flaps to this tricuspid valve. You may also see, because it is a frequent feature found in the right ventricle in particular, more than the left ventricle, is a strip of muscle called trabeculae. See this strip? It looks like it may be a chordae tenonate, but it's actually a very thick piece of muscle going from one part of the wall to another part of the wall. If it is in your way and preventing you from having a good look at the valve, just snip this trabeculae, piece of trabeculae off. It's not needed. The important thing is that you can identify the right ventricle, which the dead giveaway is how thin the free wall is compared to the left ventricle. Once you've identified the right ventricle, you could then easily name the valve in here. This is one of the atrioventricular valves because it has flaps, chordae tenonate, see these nice little strings here at the bottom of the flaps, and then that is a papillary muscle. See how it's a bump of muscle coming off of the free wall or off of the wall, because it can come off of the septum as well, where chordae tenonate attach. That is a papillary muscle. We can see here is another view. This is a papillary muscle with chordae tenonate going into it. I'm going to cut and remove some more of the right ventricle free wall so we can have a better view yet of the tricuspid valve. Now you should be able to see very nicely the tricuspid valve. We're actually looking from below up into the right atrium. If I put my finger into this hole back here, sorry, still find it. Here we go. This is the hole, so we have, back to orienting the heart, left atrium, pulmonary artery, aorta, brachiocephalic trunk. The hole right here, if you put your finger into it, leads to an atrium, so we know this is the right atrium. If I were to stick my finger all the way through it, you can see this is where it goes. It goes from the right atrium, so where blood would go, from the vena cava, about where my knuckle is, into the right atrium, down across this tricuspid valve and into what would be the chamber of the right ventricle. I'm going to remove the free wall entirely. And obviously I will have to do some damage to this tricuspid valve in order to do so, but hopefully it'll give you a much clearer view. I'm going to cut off this papillary muscle so we can still have chordae tenonate attached to it, and you can still see after blood enters, put this here, enters through the right atrium, crosses this tricuspid valve and comes here into the right ventricle, the right ventricle will then squeeze. Blood then comes up and goes out the pulmonary trunk. So if we just follow the probe, you can see where this probe is going to lead out. So where I have these two tools bisecting, we have blood entering in, we have blood going from the right atrium, crossing the tricuspid valve at this point, coming into the chamber that is the right ventricle. When the right ventricle pushes against, squeezes against the septum, squeezes like a pocket, ejecting blood up through this outflow tract that's underneath the blade of the scalpel, following where this probe is, out through the pulmonary artery into the lungs. Let's cut this outflow tract open so we can have a look at the pulmonary semilunar valve. What you should see here, so intact, we would have, remember, again to orient yourself, left atrium, right atrium, pulmonary artery, it's most anterior, and the aorta right behind it. So if we lay it down here, we would have the right ventricle on this side, left ventricle on this side. And just to persist, this is where we would see that pocket of the right atrium pushing against here. I cut open the right atrial outflow tract. So if we open this, we can see this is the pathway that blood would go to eject. It starts from the right atrium, enters into the right ventricle, and when the right ventricle squeezes, blood comes out across this area through, see at this point we're still in the ventricle, into the pulmonary trunk. What I want you to look at here is the pulmonary semilunar valve. So if we have, I'm going to cut the pulmonary artery down a little bit so we don't have so much pulmonary artery. We can see this valve from the superior as well as the inferior view. If you open up and look at the pulmonary artery down, you should be able to see, if we hold this open, you should be able to see some of these cusps. A cusp here, looking like a kangaroo pouch, another cusp on this side, and the third cusp is here on this side. So those three, when this is encircled here, allows blood to come up and through, pushing these cusps to the side. Yet when blood starts to come back into here, blood will fill up into these cusps, pulling them together, creating a very tight seal so blood doesn't go back into the right ventricle. It can push out, but it cannot go back in. So this is a nice and effective one-way valve. The aortic valve looks the same, however it's a lot harder to get to since it's right in the middle here. So the pulmonary artery semilunar valve is much easier to get at and look at the cusps. So to review the right side of the heart, we have right atrium. Blood goes from the right atrium down through here, crossing this tricuspid valve where we can see papillary muscle, chordae tendineae, the strings attached to the papillary muscle, attaching the muscle to the valve flap. On the right side, it always has 3 flaps. That's why it's called the tricuspid valve. It is also known as the right atrioventricular valve. You can use either name. Blood, once it makes it down here into the right ventricle squeezes, sends blood up this outflow tract out to the pulmonary artery. When we open it up, we can see the nice semilunar valves, the pulmonary semilunar valves here, with its cusp that has no chordae tendineae or papillary muscles. It's just a cusp like a kangaroo pouch. Let's look at the differences between the atrial muscles and the ventricular muscles inside. So we're going to just cut right through and irreparably damage this tricuspid valve. Cut that little chordae tendineae. So what we have now is an opening between the atrium and the ventricle. Notice how web-like the interior of the atrium is. This web-like pattern in here is called musculi pectinati. Your book sometimes likes to refer to it as the pectinate muscles. Traditionally, they have been called musculi pectinati. That is in the atrium. It's very mesh-like. The ventricles has more strips of muscles, if you recall the trabeculae that I cut. So the inside of the ventricles are called trabeculated, is the term referred to its texture, or when you see a strip of muscle across within the right ventricle, this one doesn't have a very good, it's actually very smooth, so it doesn't have very many trabeculae, but that's what it's called, trabeculae in the ventricles, where musculi pectinati in the atrium. Now let's look at the left side of the heart. It's a bit more difficult to get at because of the thickness of the chamber, so it's harder to open up. In this case, what we'll do is we will cut off the left atrial flap, so maybe we can see down into the valve portion. See that superior view of this valve. So if we look down, we've removed the atrium. So assume this is an area that's filling up with blood. Blood will go from the atrium, dropping down and go into that left ventricle. You can see here's where my finger would come out. So if we open this up, you can see that it looks like a nice little funnel. If I were to bring my finger up from below, and I'm going to try to grab onto a cusp, you hopefully can see a cusp closing. So if I have this, my finger's pushing up as hard as I can, and you can see where this cusp is preventing my finger from entering what would be the left atrium. Versus if I remove my finger, now you can see where that valve flap drops down very easily and quite nicely. So during ventricular filling, blood goes right from the lungs through the atria straight across this left atrioventricular valve, also known as the bicuspid valve because it only has two flaps, or mitral valve. Mitral valve is actually the most frequently used name for this valve. Blood will cross this mitral valve and enter the left ventricle. Let's cut the left ventricle open so we can see this pathway. Cut straight down here. If we open this up, you can see here the nice view. We have the left atrium. You have a nice left atrium. We can see actually it's much smoother than the right atrium is. We can see the ring here where the valve begins. This is a really nice view of one of the flaps of the tricuspid valve, this is a very good view of one of the flaps of the bicuspid valve. We can see how thin it is. It looks like saran wrap, just slightly more opaque, and the opaqueness is due to the formaldehyde and the preservation procedure. Here we can see chordae tendineae connected to a papillary muscle here. We have another small papillary muscle connected to chordae tendineae. It appears that this valve has three flaps, but it does not. I have cut this other very large flap in half, so it looks like there's a piece. So half of it's here, the other half is over here. You can see in this case a lot of trabeculae, small trabeculae. The right side had more that single thick beam of trabeculae. In the left side, you see it's just much more web-like and smaller and delicate. So trabeculae carneae is the official, most proper term of this textured feature of the walls inside the ventricles, where musculi pectinati is the name, the inside for the muscle walls inside the atria. You can also see a thin layer here of skin-like surface where some of it's been exposed. If we try to zoom in, see if what you should see here is actual muscle tissue here, that's myocardium, and then you can see this whitish gray sheen, that is endocardium. So when we refer to myocardium, it really is just the muscle portion. The endocardium is just this thin film that's inside that you can literally rip. It's just very thin. It's the lining of the heart. It's where it's actually touching the blood, versus the myocardium being the force or the muscle portion of the heart.